find yourself fidgeting in social settings, repetitively bouncing your leg, chewing your nails, or cracking your knuckles? Each of these is an example of a nervous habit, which are behaviours that you might partake in when you find yourself in a situation, environment, or presented with a stimulus that you find anxiety-provoking. Habit behaviours are usually highly repetitive and manipulative, and although nervous habits rarely result in long-term physical consequences, they can be highly embarrassing. Do you want to reverse your nervous habit? I am a psychology student, and by drawing from behaviour modification theories I have learnt in class, I will be telling you how you can reverse a nervous habit. Some common examples of nervous habits that might have hold of you include finger drumming, hair stroking, knuckle cracking, thumb sucking, paper ripping, scratching, or fingernail picking. A behaviour that might once have merely been a one-off is repeated over and over until you begin to perform the behaviour without even thinking about it. An imperative thing to understand about nervous habits is that for the most part, there is no social reinforcer. Rather, the behaviour serves as a self-stimulating function that is non-conscious. In order to reverse this, I will be walking you through the steps of the habit reversal procedure. Step 1 is awareness training. This step involves two very important establishing aspects. The first is to pinpoint the exact behaviour, and the second is to investigate the situations that the habit behaviour usually occurs. You can do this using a small notebook, your smartphone, or really any other counting device. But you also need to remember to record what happened in the moments preceding the nervous habit, as well as the context of the habit. And if you're doing this appropriately, then hopefully you should, over the stage of about 7 days, begin to see a pattern. Once you have established the behaviour and its context, you can move on to the second step, which is to create a competing response. A competing response is an appropriate alternative behaviour that you can perform in replacement of your awkward nervous habit. The behaviour that you choose as a competing response should be natural and hard to notice in a range of contexts that you usually find yourself. Some examples might be to sit on your hands, to grasp a pencil tightly, or to clench your fists. If your habit behaviour is more severe or distracting, then you should try to utilise the muscles that habit behaviour uses in your competing response. For example, if your habit behaviour, or nervous habit, is shoulder jerking, then your competing response should use the muscles that shoulder jerking uses. So you might decide to depress your shoulders using all the muscles in your arms. After you have established your competing response, you should be constantly aware. This step involves reaching a state of awareness where you become constantly aware of your habit behaviour and are able to engage in your competing response. This might take a few goes, but because you've already established the situation where your nervous habit usually occurs, you're usually able to anticipate when your nervous habit might occur. Along with consistent awareness, your behaviour should be generalisable. By this stage, your competing response should be generalisable, or the same in all situations. If this isn't the case, then you should practice your competing response using imagined situations to emulate anxiety-provoking settings that you might find yourself in. Step 5 is social support and self-management. Social support and self-management are important for the sustained engagement of the competing response as opposed to the nervous habit. You should tell your close family and friends about your recent endeavours and ask them to praise and encourage you for engaging in your competing response, or correspondingly to prompt you for engaging in your nervous habit. You should also be constantly reminding yourself of engagement in your competing response as opposed to your nervous habit, and be aware of environmental triggers as well as the improvement that you've made from the baseline. So just to quickly recap on the procedure, the first step is to establish the behaviour and its contextual causes. The second step is to create a competing response. The third step is constant awareness. The fourth, generalisable, and the fifth is to find social support and self-support to remove the habit behaviour over an extended time period, and hopefully forever. In understanding the habit reversal procedure, it must be said that if you are trying to change the nervous habit of a young child or an individual with an intellectual disability, alternative treatment might be used. For example, if a child is sucking their thumb excessively, aversive taste treatment may reap more reward than a competing behaviour application. Thank you for watching. I wish you luck with your nervous habit reversal endeavours.